All right, hello everyone. Welcome. This is our introduction video on our injury prevention for high school athletes project that myself and Dr. Rial are looking to perform. So we look forward to telling you about it and introducing ourselves a little bit.
Hi there, my name's Chris Rial. I practice family medicine and sports medicine at Lee Calm in Erie. I've been here for the past 12 years. I'm the program director of our sports medicine fellowship training program. Um, and I also teach a little bit at the medical school around seeing patients. I'm team physician for Allegheny College and also a number of the local high schools here. And part of my reason this has been a dream of mine to do something like this is just my passion for preventative medicine. Um, whether you're talking about a heart attack or a knee injury or an ankle injury, my personality kind of fits. If you can prevent something from happening before it happens, then you're that much ahead of things. And that was kind of my motivation behind this project before I met Dr. Chessen, who is going to introduce himself as well.
Hey everyone, I'm David Chesson. So I'm a practicing physical therapist and I teach at Seton Hill University in Greensburg, so a little bit south of you all. I teach in the Doctor of PT program and I focus primarily on orthopedics and sports, injury prevention. And this is how myself and Dr. Rial kind of got connected is our passion with injury prevention, actually, and working with athletes and especially high school athletes, because if you could prevent an injury at that age, it actually sets people up much better for later on in life. So this is why this is such a crucial area to focus on. So Dr. Ryle will go into the purpose of why we're trying to do this.
Yeah, so the rate of injuries, not only in high school but college, pretty much throughout all of adolescence, is increasing. And the purpose and goal of this is to work towards reducing that injury risk again before the injuries happen. We're focusing essentially in lower extremities, so below the waist, hips, knees, ankles. But also the the studies have shown with these programs that they actually sometimes can enhance performance as well. So that's part of the equation too. We're actually using a program that's been established for a number of years. It's called the PEP program, which stands for Prevent Injury and Enhance Performance. There's a lot of very high quality studies around this particular program, many of them in Europe, showing that it can reduce specifically ACL injuries of the knees by a very high percentage.
Wonderful. So yeah, the it's going to be a really interesting project. We look forward to performing it with everybody. And this is probably one of the key points of this is that participation is completely 100% voluntary. So if you as the athlete, if you as the parent, guardian, if you decide not to participate, then there will be no negative consequences. What that means by not participating is that we will not therefore record any data or collect any information from your athlete. So you or the athlete. So again, this is a really critical point to mention of this is that it is completely voluntary. We will coordinate with the coaches to send out informed consent forms. All of the information on the study, the confidentiality, all of that will be on the informed consent form. So you feel free to take the time to look over it and review it. We want you to be comfortable with participating, but again, there will be no negative consequences. And the other thing is that whenever you participate in something, there is um, some sort of risk in participating. Now, from what we are proposing, we're not doing anything completely novel or crazy or anything that's kind of out of bounds in any way. This is a regular warm up program that has been shown, as Dr. Ryle said, to be effective at reducing injuries. So, this is something that we are going to work on implementing with your team. I don't believe there are a lot of parallels from what you're already doing to my knowledge. So, again, we're not expanding it drastically, but there are no additional risks to participating that we foresee other than just your general risk of performing any sort of physical activity. So the athlete, what will you be doing, right? So Dr. Rial, go ahead, take away kind of the next
No,
part here.
that's fine. Yeah, I mean, your role is essentially the reason why we have to get permission as an athlete and as a parent is because anytime that we record data, which in this case it's going to be injury rates. So if you have an ankle sprain, we're going to track that. Don't track that. That's why it's considered a research project, and we have to have signature from the athlete, from the parent. I hate the word research because it sounds scary, like we're doing something novel, like Dr. Chessen said, something novel or out of the box. This is an established program. It's been around for greater than 10 years. Our role is, how do we teach that? How do we get buy-in? So essentially the coaches, the captains, we will be there and they will be the ones actually leading this. It takes 15 minutes total. Um, Different schools are doing it differently, whether they're doing it to do that every day or not every day, every other day, whatever. But the bottom line is your role is just essentially that we're measuring the injuries, and then we're also going to measure a couple of performance parameters just to see, is there a chance that by doing this, not only do we decrease injuries, but do we increase performance? So David, you want to talk a little bit about that?
Yeah, so that's actually a big point, right? So again, if we could find that there's a dual benefit to doing these programs, then again the classic kill two birds with one stone, right? So if with this program we are interested in looking at those kind of performance measures, so we are interested in looking at the beginning of the season, so again hopefully within the next couple weeks here, but we look to measure agility, so doing a 5-10-5 agility test, and then also looking at vertical jump height. So those are going to be our two performance measures that we're going to look after. And then obviously the injury rates. So we're going to be coordinating with the coaches, with the captains, with the athletic trainers, and we are going to work on trying to collect some of that data. Now, again, just from the research perspective, I want to be very, very clear about this, which is everything is confidential, meaning the only people that are going to see who has an injury and in terms of the research study itself will be myself, Dr. Rial, the athletic trainer. Okay, so that none of that is going to be published. None of that identifying information is going to be out there. All of this is very, very confidential. Okay, and we are going to keep all that information in a sort of password secured, locked type of online platform. Okay, so again, I just want to be very clear about that because I think that's probably another concern that people have is that sort of confidentiality aspect. All of that is going to be kept very, very covered up. Okay. So again, this injury prevention program will be performed as well throughout the season with the coaches and the captains kind of helping to lead that charge. As Dr. Ryle mentioned, the PEP program, Prevent Injury and Enhance Performance, right? So, what is that program? Just to give you a very brief sort of outline on it, it consists of a lot of things that you're already doing: stretching, strengthening, plyometrics, agility movements. These are all types of things that, from my understanding, that you're already doing to some degree or not. It's just that this program is a little bit more standardized and it's been shown from a research perspective to be beneficial in reducing injuries. So again, this is sort of why we're implementing it. And we're going to get into more specific detail about the components of the program when we meet in the near future here. So again, those are sort of the component parts of it, and it should only take about 15 minutes to complete. 10 minutes as a warm up, and then 5 minutes afterwards as a kind of post activity stretching routine. And again, we're going to go into the details of that program when we meet pretty soon here. So, the education part.
Yeah, so we're going to just do throughout the season. We're going to send out just very like snippets of these are some educational sessions. related to injury prevention. So not only are we doing the program, but we're looking at some of these other aspects of performance and things that can affect performance. You know, as a physician, as a physical therapist, you know, we think that this plays into it. We may build upon this in the future. David, is there anything else you wanted to say about the injury prevention?
Yeah, so in terms of injury prevention, this is the key difference between what we're trying to do and what all of the other programs out there are doing is that every other research on injury prevention programs revolves around the program, aka the PEP program. There's some other injury programs out there, but that's all they focus on. Dr. Rial and I talked and we said, you know what? There's more to it than that, right? So what we are looking to do is to record some informational sessions, and then get that out to you. So we plan on disseminating that out to the coaches, to the athletes, even if the parents are interested, we can send it out to them. But again, the idea is that we want to supplement the physical component of injury prevention and bring on this other educational aspect to it. So why is it so important to adhere to these programs? Why is sleep so important? Why is it so important to be hydrated, to have adequate nutrition? And again, kind of the third rail topic that no one really likes to talk about, but has been shown to actually have a very, very significant impact on injuries is mental health and then the overall management of fatigue, which includes both mental as well as physical fatigue. So these sort of educational topics, we are going to put together very, very brief, less than 10-minute little recorded sessions on. There's going to be some evidence there, but more importantly, there's going to be practical advice that you can adhere to and look after and say, okay, I'm going to try to do these things to try to help reduce my injury, to try to improve my performance, and it's evidence backed. So those are all things that we plan on putting together. So just in summary, real quick, what we're looking at is having you perform this daily or however your coaching staff sees fit, this kind of injury prevention program, the PEP program that we talked about, and in conjunction with that we are going to provide this sort of educational information sessions, so that you can understand some of these other component parts that are necessary for reducing injury. And that's sort of the game plan. That's what we're looking to do, and we would really appreciate your participation in the study because, well, we think it would help you, and we think it would be a really good thing to do. So, anything else, Dr. Ryle, that you would add?
No, if you want to flash up our contact information, David, just for anyone that wants, you know, if you have a particular question, before, you know, again, we hate the fact that you have to sign a consent form, but because we're measuring injury data, we have to do that. And so, but if there are particular questions about how we do this, we have already talked to everyone's athletic director, athletic trainer. Everyone has been on board from a school standpoint. This is specifically for parental guardian information. So, but if you do have anything, that's what we are here for. These are our direct contacts. Please feel free to email.
Sounds great. Looking forward to seeing everyone in a little bit. And again, like Dr. Ryle said, please feel free to reach out if you have any questions. Thank you. Bye.
Thanks, everyone. Bye.